Hey, this is Amanda, and we are back with the next video in the series of the CBMT exam review. And today we have anatomical term review. So, starting with anatomical position. So, this is important because this is how different things are commonly referenced, which is going to be a lot of this video, is understanding how to commonly reference things. And so, the anatomical position is the assumed position the body is in, and that is always in a standing position with toes pointed forward, arms at the side, palms facing forward, and towards the observer. And so we're going to be using this as we go through the rest of our information today. Okay, so when the body is in that position, there are different planes of the body which help us kind of divide up the body in order to, again, more easily reference certain things. So the first plane we're going to go through is the sagittal plane. This is also called the longitudinal plane. And what this is, it's the vertical plane that separates the left side from the right side. So you can see in this picture, it's kind of cutting you right down the middle. And all of these you can just kind of imagine like a sheet of plexiglass, almost like dividing your body. So sagittal is vertical. The coronal or the frontal plane separates the front, also called the anterior, and back, the posterior, from the body. So this one kind of goes like right through your shoulders, just like it shows in that image there. And then the last of the three main planes is the transverse plane, or sometimes the axial plane. And this separates the upper or superior and lower, inferior halves of the body. So to kind of review, transverse is separating the upper and the lower. Coronal separates the front and back. And sagittal is the left to right separation. Okay, so now that we know the planes of the body, let's review relative location terms. Get excited. Okay, and all of these are listed in pairs of opposites. So anterior to posterior, medial to lateral, and so on. So starting at the top, we have anterior toward the front, posterior toward the back. For me, it helps to try and visualize these things with maybe a motion or something. So anterior is toward the front, posterior is toward the back. Medial is closer to the midline, which is defined in the planes of the body. And lateral is farther away from the midline. So for example, if my finger is here, it is closer to the midline being this middle line of my body. And if it's here, it's farther from the midline. Deep is farther from the surface. We all, I think, know deep. Superficial is closer to the surface. Example, if someone is superficial, that they're not a very deep person. Parietal, and my apologies if I don't say these right. I'm just trying my best here. Parietal is the external wall of the body cavity, and visceral is towards an organ. So again, it's kind of similar that parietal is going to be the external wall, and visceral is more innards to the organs. Rostral, otherwise known as cephalad, is toward the head, and then caudad is toward the tail. Central is toward the center, and peripheral is away from the center. So you kind of get into this with nerves. They're your central and peripheral nervous systems. Dorsal is towards the back. Think of like a dorsal fin is on your back. And ventral is toward the front. Ipsilateral is same side. Contralateral is opposite side. So contra, kind of think people that are rubbing against each other, not agreeing. They're on opposite side. Contralateral. Proximal is closer to the trunk or point of origin, whereas distal is farther from the trunk or point of origin. Proximity, proximal is close, distal is far. So I know we're going fast, but we have a lot to cover. So feel free to go through that again, but we're going to move on to movement terms. Again, these are in pairs of opposites. So abduction is movement away from the midline, and adduction is movement towards the midline. So abd is away, add is in, together. Antiversion is tipping forward, retroversion is tipping backwards. So kind of like retro, back, anti, forward. And again, anti-flexion is bending forward, and retroflexion is bending backwards. Dorsiflexion is flexing foot up. Plantar flexion is flexing foot down. The way I kind of think about this one is the plantar is the bottom of your foot. So thinking about flexing down is plantar, and then dorsa is up. Elevation, upward movement. Inversion, inward movement. So again, elevator, going up. Inversion is inward. We have flexion, which is bending or decreasing the angle, and extension, which increases the angle. So flexion, say we're putting our head down, it decreases the angle of our chin to our neck, right? And extension increases that angle. Medial rotation is surface to the midline. Lateral rotation is surface away from the midline. These next two are important. I feel like I've used these a lot in documentation. Prone is lying face down. Supine is lying face up. Think supine, spine, supine on the spine. If you're on your spine, you are lying face up, whereas prone is lying face down. And then to go with that, pronation is movement toward prone, and supination is movement toward supine. Protraction is forward movement. Retraction is backward movement. Okay, in a lot of those, you probably recognize that there was some similar prefixes and suffixes that you were kind of like, wait, that's the same word, just with a different half of it. That's why it's important to kind of understand some different prefixes and suffixes. This is not a be-all, end-all list. This is just a couple examples. I tried to give examples of things that people might know. So if you're like, oh, I recognize that prefix or suffix like with a psychology word, that's great. Make that connection, and we'll probably talk about that actual definition of the word you're thinking of in a different video. So start off with A, not or absence of, such as asymmetry, not symmetrical. Emia, related to blood. For example, anemia, which is a lack of blood. Algia, which is pain. For example, fibromyalgia, which is widespread pain in the body. Angio is vessel. For example, an angiogram, which is a scan that shows blood flow. Ante is before, so an antecedent is a good example. Antecedent is like a preceding event or story. So ante, before. Anti is against or attacked. I think we all know anti, but an example here is antibacterial. Arthro, related to joints. Arthropathy is a joint disease. Bi, two of, for example, a bicycle has two wheels. Brady is slow. Example here is bradycardia, which is a slow heart. Cardio is heart. Think of, cardio, running, that gets your heart pumping, it gets it up. Cardio, heart. Or example here, a cardiogram, EKG. Cephal, head, and the example is cephaliac, which is of or related to the head. Contra is to go against. So our example here is contraindicated. Contra, against. All right, dys, abnormal. So for example here we have dysfunction. Ectomy is the removal of, for example, a hysterectomy. Endo is inside. For example, your endometrium is the inner lining of the uterus. Gastro relates to the stomach. Hemi or heme is half. For example, hemiplegia, which is paralysis of one side of the body. Hyper is high or elevated. For example, hyperglycemia is high blood sugar. You can also think of like hyperactivity. That's high activity, right? So more elevated, hyper. As opposed to hypo, which is low, depressed. For example, hypoglycemia, which is low blood sugar. So it's important to know the difference between hyper and hypo. Intra is within. For example, intracranial is an injury to the inside of the head. Inter is between. For example, interact, two people will interact, and that conversation is between them. Oma is a tumor, for example, carcinoma, which is skin cancer. And osteo is bone. So our example here is osteoarthritis, which is bone disease. And last but not least, we have otomy, which is cut into. So our example here is craniotomy, surgery on the brain. So that was kind of rapid fire of a lot of terms. You can go back and look at that again, make yourself a Quizlet. This is not a be all end all, and you don't need to necessarily know all of these example words that I'm giving. The point is to try and connect the prefix or suffix with a word that might be familiar to you before in our next videos we apply those prefixes and suffixes to things specifically in psychology and music therapy. With that being said, good luck on your studying. You got this, and we will see you next time.